pediatrician at Thibodaux Regional Pediatric Clinic and a mom. And like many of you, I've been seeing the news about measles coming and going. We've been talking about it in Texas, now spreading to other states. And then as of this past weekend, it's in New Orleans, which was a bit of a blow to the gut. I feel like I was anticipating it, but maybe not expecting it already. So I wanted to discuss a few things about the measles. I don't think it's a reason for us to be afraid or panic, but I do think it's time to be proactive and prepare for the very real chance that we could have an actual outbreak of measles in 2025 here in Thibodaux, Louisiana. So first, what is the measles? The measles is a highly contagious virus which is spread through the air or through contact with surfaces that have been contaminated. It is not only a very contagious virus, it is one of the most contagious viruses ever discovered. In a room of 10 people who are unvaccinated, if a person who has measles is exposed to that room, 9 out of 10 of those people will become infected. That is a very high number. And on top of it, we know that that virus can live in the air for up to 2 hours after an infected person has already left the room, which just opens the opportunity for so many unknown exposures to be going on. We also know about measles that it can take 2 weeks from an exposure to start seeing symptoms of the measles, and your symptoms can start several days after you've become infectious and started spreading this virus to others. The most common first symptoms of measles include fever, oftentimes very high fevers, 104, 105 and above, cough, coryza, which is that runny nose, sneezing, congestion type of symptoms, and conjunctivitis, which can look like red, watery eyes. And then a few days after that, you may develop tiny white spots, little sores inside the mouth, we call Koplik spots. And after that, on day 4 or 5 of symptoms, oftentimes is when the rash develops. The rash from measles specifically starts at the hairline and spreads down towards the toes and the extremities, and oftentimes resolves in that opposite direction. So this is the symptoms initially that we'll typically expect to see with measles, which may seem like a cold. And you may be thinking, why is this such a big deal? Like cough, conjunctivitis, a little runny nose, that sounds pretty typical. Aside from these people feeling absolutely miserable, what we really worry about are the serious complications that can come with measles. We know that 1 in 5 people infected with measles will have to be hospitalized. We also know that 1 in 20 people infected with measles will develop a pneumonia, which is the leading cause of death related to measles. Also, 1 in 1,000 people will develop encephalitis, which is inflammation and swelling of the brain, which can have lifelong effects as far as brain damage and inabilities to walk and talk and having to relearn all of those things. On top of that, of course, the most serious complication would be death, which occurs in 1 to 3 out of every 1,000 people infected, which may not sound like a lot, but when you're thinking of how many thousands of people are going to be exposed to this, that's a very high number. So what to do if you think that you may have been exposed to measles or that you may have contracted measles? The most important thing is to talk to your provider. They'll have a plan in place and know what to say to guide you and how to best make sure that you're taken care of while also minimizing the risk to others. The good news is we really don't need to be afraid of measles because we can be proactive and work together to minimize the risks here in our little town. The most effective way to prevent measles is to be vaccinated against measles. We know that within 2 weeks of receiving your first measles vaccine, you're protected approximately 93% from catching the measles. After the second dose of the measles vaccine, which can be given as soon as 28 days after the first, your protection is closer to 97%. Unfortunately, we cannot protect everybody. There is still going to be that small percentage of people who don't respond to the vaccines, or those who are immune compromised and cannot form a response to the vaccines, or those few people that do not tolerate the vaccines for a few specific reasons. So for that, we really rely on herd immunity. So the best thing that we can do to help prevent the spread of this terrible disease is to increase the vaccination among everybody. Measles requires 95% of people to be vaccinated for us to have enough herd immunity to protect those who are vulnerable. So I would just urge everybody, if you're not sure if you have protection against measles, if you're wondering what you can do to help others, please talk to your pediatrician or your physician about options for getting vaccinated and protecting yourself.